Hey everyone, have you ever wondered about trigger finger, and what about arthritis? Where is arthritis? What joints does it go after? What treatments are available? Hello everyone, this is Dr. Jason West and the West Clinic team, and I wanted to share with you a patient story. It's about someone that had a trigger finger, an arthritic knee, and a leg ulcer. Now, they weren't all at the same time, but there's some really neat ways to take care of arthritis, to help tendons heal, and to rebuild the tissues around the ulcers. And this is a story about all of those treatments and how it helps those symptoms. And in a minute, you're going to meet Ron and hear Ron's story, because proof's in the pudding. And as always, there's a free report on this condition. Just type MOVE in the comment line, and I'll send you a free report on regenerative injection therapy and arthritis. Now, in a minute, you're going to hear Ron's story. And I love it when people ask about certain conditions, and when you show them someone that's had a successful outcome, it really, really helps. So let's talk about trigger finger. It's a condition where your finger gets stuck and then suddenly releases, like a trigger. It has a fancy name called stenosing tenosynovitis, which is an inflammation around the sheath of the tendon. And if it gets bad enough, sometimes it gets locked, most of the time in a bent position. And a risk factor is people that work in repetitive or gripping positions, or people that have hobbies requiring a lot of repeat actions. And the symptoms are finger stiffness, particularly in the morning, a popping or clicking sensation or tenderness or bump or nodule, and it can affect any joint, but it really likes the fourth fingers of each hand. Now, I've found that natural vitamin E, selenium, and something called regenerative injection therapy can really help. And arthritis, it's a common but informal way of referring to joint pain or joint disease. And there's a lot of different types of arthritis, actually over 100. And all types of people, all ages, men, women, children, even animals have arthritis. 1 out of 6 people have arthritis, and more than 50 million people and 300,000 children have some type of arthritis. Now, some of the symptoms of arthritis include swelling, pain, stiffness, and a limited range of motion. And the symptoms can be mild, moderate, severe, annoying, or even life-threatening. And it can limit your ability to get in and out of cars, to go up and down stairs, and to do the activities of daily living. Now, sometimes you can see arthritis, sometimes you can't. Some changes are visible with x-ray, and sometimes the arthritis affects the heart, the eyes, the lungs, kidney, and even the skin. Now, some of the most common types of arthritis are inflammatory arthritis, infectious arthritis, metabolic arthritis, and osteoarthritis. Now, the medical treatments are usually anti-inflammatories, pain relievers, muscle relaxers, or steroid therapy. And in Ron's case, we didn't use any of those. What we did is to put the body back in balance. We gave some medical nutritional therapy, some building blocks, and performed regenerative injection therapy. They say proof's in the pudding. Here's Ron's story. Okay, hey everyone, Dr. West and Ron, we're excited to tell you about a really neat patient story. I'm not going to steal any of your thunder. Really enjoy taking care of Ron. Sometimes you really connect with people. It's always fun when he comes into the office. 1, because he's a great person, but 2, because we've really helped him. So, tell your story.
I came in first to have a bad knee fixed because I didn't want to go to the hospital and have it replaced, and I still don't. And they took the pain away from that probably in 5 or 6 treatments. It's not 100% yet, but it was completely shot for 10 years before I had anybody look at it. And then the next step, as I came in, I held my hand up and I went like this. And that's the best fist I could make. And that's the straightest hand I could make with the left hand. And both of the center fingers were trigger fingers. And he gave me some herbs, and I came back in, I think it was 2 weeks later.
Right.
And I walked up to him and did that and said, "Can we get rid of that terrible medicine the doctors got me on?" And so now all I take is the herbs for my arthritis, and it's doing wonderful. Took a couple of weeks before I didn't have to make that one work. But arthritis was bad and no longer there. Then I had my right knee fixed and my right hip fixed, and I couldn't play football with my grandson the shoulder hurt so bad, and I had that fixed. And those items are done. I haven't had any problem with them since the treatments. And then I've had a ulcerated foot that the doctors were giving me some medication for, and it wasn't doing anything. And Dr. West saw that and said, I can fix that for you. And he did a process called limb bagging, which is oxygen and ozone.
Oxygen ozone combination.
And I've been treating that, and the open wounds started healing within a couple of weeks, which was very exciting to me because they'd been that way ulcerated for some time. And I'm just very pleased with West Clinic and all their staff, and everything's been really good for me here, and I appreciate them and love them for what they do.
So, and we love Ron too. It's just, you know, my dad told me that sometimes that you'll run into someone and you'll really make a difference, and you get paid more than money because it's personal satisfaction. And Ron, I just really enjoy taking care of you. We love it when you come to the office, and it's been neat to see him go from a bad wing to a good wing and better hands, and then working on this foot ulcer. It's just a real overall neat experience. So, Ron, can I put this up on social media?
You can put this up on social media.
Right, awesome.
I'd be glad to have you do that.
So, anyway, everyone, this is Dr. West signing out for Daily Dose of Vitamin H. We'll talk to you later. Hey, thanks for watching Ron's story. There's some really neat natural ways to treat trigger finger, arthritis, ulcers, sore muscles, and some of the treatments are regenerative injection therapy, prolozone therapy, neural therapy, IV micronutrient therapy, and specific targeted nutritional therapy. And if you'll comment on the video, I'll get you a free report on regenerative injection therapy. Now, please like the video, and if you click on the little bell next to the video, you get notified on my next video. This is Dr. Jason West and the West Clinic team, and we'll see you on the next video.